Hi, Gallagher. I am a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. So a very common question I get, and I think it's one of those myths out there are many of them, is will binding screw up my chest for top surgery? And I would say no. I really don't think so. I don't subscribe to that. I think maybe the only time it could possibly interfere with it is if you had very small breasts and you were a candidate for a areolar type incision, so the keyhole type surgery, and somehow you squish down your breasts so much that they're now looking at the ground and you have saggy skin and you're no longer a candidate. I don't even know if that really happens, but I would say in general, binding does absolutely nothing to interfere with your top surgery results in the long term, particularly if you're going to undergo a double incisions type technique. And in fact, sometimes I think it actually helps me, because when the breasts have been bound down and I mark a patient before surgery, I can usually kind of clearly see where their pec muscle is, and so I know clearly where my lines have to go to land that incision right underneath where the pec muscle inserts, or in those folds underneath the pec muscles where we really want to ideally hide the incisions if at all possible. So I actually think sometimes binding kind of helps me find that, because the breasts have been kind of pushed down and out of the way of the pec muscle. That's just my belief, but I would say don't subscribe to the guilt trips. Binding is not going to screw up your top surgery. I hope this helps.